For most people, the carpal tunnel experience is a cycle of dead-end solutions. You start with a bulky brace and ice, move to rest, and eventually face a conversation about surgery when the numbness keeps coming back. Standard medicine identifies this as a structural failure. Specifically, it's a physical pinch of the median nerve within the wrist. Wrist braces provide a temporary shield, but they don't address the systemic environment of the hand and forearm that allowed the inflammation to take root. This vintage anatomical illustration reveals the wrist as a high-density transit hub, where every millimeter is claimed. Inside, flexor tendons and the median nerve are packed tightly. When soft tissue swells, the rigid tunnel acts like a vice, crushing the nerve. Moving past the pain requires looking beyond the local pinch to evaluate the entire traffic flow of the arm. Traditional Chinese medicine views the wrist as an energetic gateway. It is a narrow point of convergence for multiple vital pathways. The system relies on qi, which functions as a biological pump. This energy provides the pressure necessary to move blood and fluids through the limbs. This comparison shows the difference. While the Western view sees a mechanical clamp, TCM sees a traffic jam, channel obstruction. When strain causes qi to stagnate, the pump slows down. Fluid pools, causing tissues to bulge and compress the tunnel from the inside. Resolving the condition depends on identifying your specific energetic traffic jam and clearing the channel. This matrix shows how your specific symptoms reveal the current stage of your blockage, which dictates the necessary treatment. Early-stage qi stagnation is typically triggered by prolonged, repetitive motion at a desk or workstation. You can identify this stage by a feeling of mild tightness that actually improves when you shake your hand or move the joint. If that early tightness is ignored, the lack of flow eventually causes blood to pool, escalating the condition to blood stasis. At this stage, the pain turns sharp and stabbing. It stays in a fixed location and is often accompanied by persistent numbness. This is the phase where you begin waking up in the middle of the night with hands that feel completely asleep or dead. TCM explains night pain through the movement of yang qi, the body's active, warming energy. During sleep, this energy naturally withdraws toward your core, causing peripheral circulation to slow. If a channel is already partially blocked, this drop in pressure makes the obstruction feel much more intense. Leaving early-stage tightness unaddressed guarantees an escalation into severe, fixed pain that requires more aggressive intervention. TCM also considers your environment through B syndrome, where external factors like weather physically invade the channels. In cold Bai, low temperatures cause the tendons in the wrist to contract and seize, creating a fixed, severe ache. Standard icing can be counterproductive here. If cold causes the tendons to seize, adding more ice simply locks the mechanism and solidifies the blockage. Damp Bai presents differently, causing a heavy, swollen, puffy wrist that flares up specifically during humid weather. Weather-sensitive pain requires a matched intervention. Primary channels crossing your wrist crease. Targeted acupressure on these lines manually stimulates the pathways to restore flow. The primary points are PC7 at the center of the wrist crease and PC6 2 finger widths below it. The median nerve follows this exact pericardium trajectory. Stimulating these points directly addresses the area of highest compression. You can support this with LU9 on the thumb side and HT7 on the pinky side to regulate overall hand circulation. For rapid relief from acute finger tingling, use the boxy extra points located in the webbing between your knuckles. While these DIY tools are accessible, they require strict daily consistency to break down chronic tendon tension. DIY care is often insufficient if you are already noticing muscle wasting at the base of the thumb or a significant loss of grip strength. A professional identifies underlying systemic causes, such as qi and blood deficiency, by evaluating your pulse and overall vitality. Clinical acupuncture provides a more aggressive stimulus, bypassing surface tissue to clear obstructions deep within the channel. Practitioners often use Tuina massage to manually break up tendon adhesions and release tension in the muscles supporting the wrist. Advanced cases trade the convenience of home care for the clinical expertise needed to restore grip strength and nourish the blood. This flowchart tracks the condition. Repetitive strain causes qi stagnation, blood stasis, then channel obstruction. For Path A's mild pain, prioritize daily acupressure. Path B's cold swelling needs warmth, not ice. Path C's sharp night pain indicates blood stasis, requiring professional acupressure. This framework trades the quick fix of surgery for a commitment to daily discipline and a closer look at your body's environmental signals. Committing to the TCM model allows you to resolve the root energetic traffic jam, restoring long-term function rather than just managing the symptoms.